by the way.
Sorry. It was on speakerphone. I didn't mean to do that.
That's okay. It's just for some reason, speakerphone sounds like you're in the Carlsbad Cavern and you can't get out. We'll, send the help for you one way or the other. But how you doing?
I'm good, sir. How you doing?
I'm doing good. There are so many different questions. First of all, I want to get this out of the way. We got Labor Day, and I know people are concerned about that. But your thoughts on because if we don't do what we need to do, then what 13, 14 days later, we'll find out about it.
Yeah, I'm really hoping that folks will be a little bit more calm for this holiday weekend. We saw pretty significant increases in cases, right after Memorial Day, right after 4th of July. Mm-hmm. We have a lot more at stake right now, too. We have schools open, so we want to make sure we keep our kids in the classroom, those who are there. We have kids in college, and, we have football season coming up. So, we have every reason in the world to just kind of have a more mellow weekend. And it's the same simple things. It's, it's just maintaining space from one another, wearing a mask in public. But I do want to warn people to be careful around extended family. And that's where we found a lot of vulnerability recently is folks will get together, so-and-so's cousin from Texas comes in, and the whole family gets it. So beware.
Last outbreak yesterday, we had, I think it was a total of 274, which was down, but I'm cautious now by ever saying anything good about it because it seems like the next one spikes. 32 additional deaths. But 158 of those were at long-term care facilities, 158 of that 274. It just seems that why are we not able to control that a little bit better?
It reflects what's going on in the community. And what we do see is we see kind of regular reintroductions into long-term care because of the employees. It's a huge challenge. Now, we're looking forward to, over the next few weeks, the federal government is in the process of shipping rapid tests to every nursing home so that they can test all their employees once or twice a week. And that's going to be super important trying to protect the folks who are living there. It's also going to be helpful for visitation because we know how desperately difficult it is for a lot of folks. We're trying to loosen up the capacity for people to visit, especially outdoors, and we'll try to make more opportunities. But it's such a tragic thing for people in long-term care for both reasons. Because of the illnesses and the deaths. I mean, if you get COVID in nursing home, you got a 1 in 5, 1 in 4 chance of dying, which is horrible. But also not being able to see your loved ones is a double whammy.
Explain to me the rapid test now. This is something new. It's the remarkable thing, and I know there's been a lot of negative news on this, but the remarkable thing is how fast we, through research and everything else, as far as the possible vaccine, the possible medicine, the mercurial thing that's coming, and also the test itself. Everything has been on as rapid development here. But explain to me the test, the new test.
Yeah, so the test that they'll be getting, it's called an antigen test. An antigen is just the protein. So it's kind of like the rapid flu test. It basically checks for the surface protein of the coronavirus. And, it's fast. It's real quick. The accuracy is a little bit lower, just to be quite honest. The DNA test or the RNA test, the PCR is going to be more accurate. But, if we test everybody in long-term care nursing homes on a regular basis, and then they, it'll hit them when they have significant disease. So it's going to be a major help.
Are the tests costly?
They should be less expensive than the PCR test, but they're still going to be pretty costly. The federal government is going to give nursing homes additional money to buy the test. When they get the machines, they'll get like a supply of 100, 200 test kits. And then after they go through those, they're going to be responsible for buying their own.
When you say rapid, how rapid are we talking about?
15, 20 minutes, something like that.
All right, now this kind of dovetails into the story over the weekend, and there were two major stories over the weekend. Number one was that some of these tests that are showing positive, and according to the research, and I'm sure you've read up on this one, some of the tests that are showing positive really should not be showing positive enough, or there should be some delineation that they are positive, but there's not enough of the virus there to be contagious. Have you read that one?
Yeah, yes, sir. Yes, sir. There's several things. There have been some false positives, like if we look at like the NFL, right, where they had all those. We've looked at that here, and that same sort of thing happened in some camps in New England. And we were very concerned that the machines got contaminated. so that they would hit positive all the time, right? So if you did that, so that's a real possibility there. Now, the other thing on the viral level that they were talking about not having enough virus to be contagious, I want to really approach that one with a lot of caution because there's so much variability on what that means by sample technique, right? I mean, depending on who does it and how you do it, you're going to have a lot of different virus. So we can't depend on that as a sole indicator of contagiousness. What we do know is that, 40% of cases more or less are spread by asymptomatic people, right? And we know that they're super contagious around the day before and at the onset of symptoms. So there will be transmission, but as we learn more, maybe we can modify our policies to sort of be more targeted.
Dr. Thomas Dobbs, would the assumption be, Dr. Dobbs, that the lower amount of virus you have, the closer you are to asymptomatic then?
That does seem to play out in most circumstances, except for kids. Mm-hmm. Kids actually have pretty darn high virus loads, and they don't have many symptoms. And so there is some variability. A lot of the symptoms depend on your immune response. And so there's two things at play, right? It's going to be the amount of virus probably, and then what your immune response does with that. So it's not going to be a pure and simple indicator. We still have a lot to tease out.
Well, here's the other part of that. When you talk about the variability of that, the flu is a little worrisome to me. It was interesting to see that survey or that research. But if you do have low viral amounts, does that mean you're coming in and going out, or is it going to be stationary? I mean, in other words, if you got that test and you had low viral amounts, does that mean maybe 2 or 3 days later they would increase? How can you get any consistency on that?
Well, I don't think that we really know that question. I mean, it's probably going to be more likely you're on the way down than on the way up. Just if you think about the curves, probably going to be a little bit more like a steep uptick and a slow downtick. So odds are, but it's going to be impossible to know for sure.
So we got 82,950 cases this morning that we've confirmed in our state. 82,950 cases.
Yes, sir.
If you went by that, do you think it would cut it in half, or where do you think our cases would be in our state?
You mean if we cut off the level of virus?
No, in other words, if let's say the rapid test would require a positive by having more viral contamination in the system, what would it cut that 82,950 to?
Well, it looks like it's about 90%. So, you might say we would miss 10% of the other ones. But like you mentioned before, it's hard to know on the timing, of when you pick them up. If you're testing asymptomatic people, and that's the key. I mean, it's asymptomatic people, or maybe they were sick before. It's kind of hard to know what you're looking at. But if they're symptomatic, it's pretty straightforward.
Well, the other part of that too, in the other study over the weekend, that the CDC said we're dropping the 183,000 people who died to what, 9,000 something?
Yeah, that was a flub. I've filled out a lot of death certificates in my life, sadly, and I never once put a single diagnosis on a death certificate. And so, and then we went back and looked at our death certificates yesterday, just to kind of see, and what we invariably saw. We took a lot of them out. You just know that if it's like something, and COVID's like the third thing, and it's not related to their death, we'd knock it out. But invariably, it's like pneumonia secondary to COVID, right? So now that's two things.
All right.
And that's kind of what they did.
Can you hold it right there? Because I want you to have a chance to finish that when we come back.
Oh, yes, sir.
Dr. Thomas Dobbs, we're talking about actual deaths. Our deaths, 2,473. We'll ask him when we come back. If you mark that death certificate purely, only COVID, how many would it be from that 2,473? Get back to Dr. Thomas Dobbs, where we're talking about the deaths, and you were elaborating on the study. The study was that the people who, according to the CDC, not 183,000 plus, but under 10,000 people, actual deaths of people who died specifically from COVID. Continue, sir.
Yeah, that's very inaccurate. So if COVID kills your lungs and you die, COVID killed you. If COVID kills your kidney and your heart and you die, COVID killed you. Your lungs and your heart would not have died except for COVID. And that's exactly what we're talking about. When we go back and look at the death certificates that we reviewed, it's like it says, acute respiratory distress syndrome, which is basically your lungs filling up with fluid and you can't breathe from COVID. And so there's two things on the death certificate. And according to that misrepresentation, that goofy thing they did, then that wouldn't be a COVID death. I'm telling you, COVID is killing people. My wife is ICU director in Laurel, and this drives her nuts because she has to deal with dying folks and families every day.
Yeah.
Same thing with other critical care doctors. It's serious. It really does kill people. Now, I know there's a real desire to kind of minimize it because we want to be normal, but I want to say, let's look at what's going on in Mississippi. Our economy's not closed. The cases are dropping. We've done a good job. We don't have to be New York or California. We can do it a Mississippi way that works, and we can still have a vibrant economy. But we do need to respect this virus because it does make people sick and it does kill people.
I don't disagree with you. I mean, the problem we're having is intelligent people just want to make their decisions based on accuracy, and I say that, Dr. Dobbs, knowing full well. Even the well-intentioned people from Dr. Fauci to Dr. Dobbs and everybody else has had a hard time because this has been a moving target. We've learned so much about this virus, things that we didn't know. And I think everybody deserves some leeway on this, much like the president himself. When you go into it 2 or 3 months later, because of the data that comes in, it may not necessarily be so.
Yeah, no, I understand. It's complicated, but, it's the same sort of stuff. We haven't had this kind of scrutiny. If someone dies of a heart attack, and I'm actually having our vital statistics pull back, if you die of a heart attack, you don't die of just a heart attack, right? You die of other secondary complications with it. So it's not going to have just a heart attack on the death certificate. So, it's just the way that the process works, but COVID is killing people. It is dangerous, but it is preventable, and we have the tools. And so hopefully we'll use those tools going into Labor Day so that we can keep our kids in school.
I guess the essence of this would be this. If we had 2,473 people in our state, but if you get down and you find out a healthy person, regardless of the age, let's say under 65 years old, man or woman, healthy, no underlying conditions, no heart conditions, no diabetes, not overweight, in good shape. The statistical chance that if they do get COVID, they would die of COVID is not that good.
Yeah, most healthy people will get over it just fine. Now, we did have a teenager die because of heart failure from COVID a couple weeks ago. We had a 2-year-old who's died from COVID. It's rare, but it certainly happens. But, that's one of the things about this chronic disease thing. Obesity is a chronic disease, right? And 40% of Mississippians are considered obese, and 60% are overweight. So, think about it. Mississippi, most people have something going on, or a lot of people do. So it's not just like this rare breed of people who have some bizarre immunodeficiency. It's most Mississippians.
In other words, it's a rare breed to find somebody without some underlying conditions in the state of Mississippi.
Yeah, that's a whole other problem. We got to work on the obesity issue too and hypertension. Yes, sir.
So, if in all reality, of that 2,473 people who died, very few, the number of deaths would probably be 24 or less, who were just in perfect shape and an example of what health should be like.
Well, it would be more than that because even a young person, they're going to die from pneumonia from COVID. And so it's going to have two things on the death certificate. So that's very, very confusing, I think, to folks because you died from pneumonia, not COVID. But if COVID causes the pneumonia, you would not have died. The same thing is flu causes pneumonia and you die. It's the flu that killed you, and it's just pneumonia is the manifestation of the disease.
I got you. In the last several months, or in the last several weeks, for that matter, anything new that you see coming down the data coming down where we've learned additional things about this virus?
Yeah, well, some of the stuff that we're seeing more and more about transmission is if you live in the household of somebody with coronavirus, you are highly likely to get coronavirus, and so that's a big topic, and so that's something that we need to be very conscientious of when we look at the transmission risks. We are learning more and more about it. I think the super spreaders is probably going to end up being one of the biggest things, and probably that's one of the reasons why the outdoor and the mask business makes such a big difference, because if you have one person who infects 100 people, but you put a mask on them, that changes the dynamics of that remarkably. The vaccine, we're real excited about that. We're working really aggressively to make sure that that's available for folks when that comes out.
Is that date does it still look like maybe by the end of the year or sooner?
We've kind of gotten some indications that we might have a limited distribution at the first of 2021. So we're working on our distribution plans right now. But there's still so much going on. But I will say it's remarkable. It's really impressive how quickly they've put together these different candidate vaccines. Now, we'll want to make sure they're safe, right?
Yeah.
I'm not going to jump the gun.
Is there going to be? Will that be an injection or tablet, or how's that going to work?
No, it'll be like an intramuscular injection, just like the flu shot.
I got you. And will that be recommended for those only 55 years older, or everybody?
No, we're trying. We still don't know. Probably the distribution sort of hierarchy is going to be, first responders, healthcare folks, people taking care of vulnerable people, then maybe the more vulnerable, and then sort of work down into the general population. We don't really know what the stuff is going to look like for kids as far as the studies and what's going to be available. Haven't heard much about that. But I think pretty much for every adult, it would be recommended.
Well, if they recommend obesity or people overweight, then that's going to cover the general population.
Stop.
Yes, sir.
Stop.
I think you're right.
Just telling you,
Stop.
have the vaccines ready by truckload because we're going to be needing them soon. Look,
we're hopeful.
What's your assessment of schools so far?
I think the schools have really done a great job. We do have a lot of kids on quarantine, and I would like to couch that as a success, not a failure, because the schools have really done a great job of sort of encircling the active cases that are in the school system and kind of making sure they sort of get that little small block. Because, if we have 3,000 kids on quarantine, but we have, almost 500,000 kids in school or in school age, that's pretty good. The real challenge is social stuff. And we've seen social events, and believe it or not, parent-sponsored social events where they have dozens, maybe over 100 kids going to them, and outbreaks, and that is really undermining us. I know it's driving the principals and the superintendents nuts because they do a good job of protecting the kids on campus. It's the off-campus stuff that's going to kill us, and that's the same thing with the colleges, because we visited Ole Miss and State last week. Their operations were really impressive. Encourages me for the football stuff, if they can do that same sort of diligence with the safety procedures. I'm planning to go to Jackson State and Southern Miss this week. So, it can be done right.
I think it can be, and it's going to be trial and error. But here's the thing. The people who are not playing at all, when they find out the other people have done it the right way and they could have done it, there's going to be some people wondering exactly why they made that decision. There was a couple of other things I was going to ask you, and I forgot what they were. But anything else that we need to talk about while we got you here? I think really just please, be careful about family gatherings. Yeah.
I think that's really. I have personally taken the call in different cases and interviewing them just to get more of a flavor of what's happening. And invariably, what we find is if you look back, say 4 to 5 days from the first date of symptoms, and you ask them, what did you do? And they'll say, so-and-so came in town, and so we all had a little party. Yeah. Or, my sister brought her kids over, and we had a pool party. Or, we had a baby shower, that sort of thing. These little small social events are really amplifying it. And so I'll tell you, it kills me, but I'm not going to visit my family for Labor Day because I think it's the wrong time. Yeah. I miss my dad.
You have to make sacrifices. We were on vacation and made sure we didn't go to none of the places that we actually wanted to go. We just made it more of a driving vacation because better safe than sorry. The question I want to ask you, let's see if I can squeeze this in here. Has the quarantine time changed at all as far as these schools and everything? Is it still about 14 days, or how long is it?
Yeah, the quarantine's still 14 days, and there's
14
data
days.
that shows clearly for the quarantine. Now, for the isolation, we're looking at some variations on that.
Yeah.
If someone's symptomatic, but still for the quarantine, and quarantines is for exposed people, it's still 14 days.
You never fail to give us great information, Dr. Dobbs. We thank you, sir.
Oh, no, thanks for having me. Hope
you got it. Dr. Dobbs, we got a break coming up. More sound bites coming up next.